Dr. Malkin, I hear a lot about biological and holistic dentistry. What is your opinion about these terms as a prosthodontist?
So I think within the scope of each different practice, the term biological and holistic could be somewhat loosely defined and depends on the practitioner exactly what they want to incorporate into their own practice. When I speak about my practice, I want to be a biocompatible practice. So when I treat patients, I try to make sure that we minimize introduction of any type of toxic materials during the treatment. So there are certain things that are now mainstream in terms of biocompatibility, and that's like safe amalgam removals. Obviously, when we're removing amalgams, we want to do it in a safe way, and we're not placing amalgams anymore. For example, my practice is not even set up to place an amalgam restoration. Another thing, in the past, we were using a lot of metal ceramic restorations, and that those restorations had inclusions of different toxic metals or metals that caused allergic reactions such as nickel, things like that. So now we really don't use metal ceramic restorations anymore. We're using zirconia restorations, so ceramic restorations, which are milled. So that's not a part of at least not a part of my practice. Another thing that comes to mind is zirconia implants. And I think it's a good implant for certain people and for certain treatments. And if a patient in my practice wants to have zirconia implants placed, we can definitely do that. Definitely the treatment and the sequencing of the treatment can change depending on the implant. And there's certain limitations that zirconia implants have, but we can still do the treatment and accommodate the treatment for those limitations. And obviously another thing, when we're using dental materials, we have to be careful to make sure that patients are not allergic to it. They're actually a test that the patients can have. We can run the whole panel of dental restorations that we usually use and see if they're allergic to certain things. And we can incorporate this into their treatment to make sure that we don't cause an allergic reaction. So for me, the most important thing is practice the dentistry that is safe, clean, and doesn't cause adverse reactions in the patients.